if we had to do a lockdown, it would be now. We should lock down now.
The Indian Council for Medical Research has finally changed testing protocols to extend testing beyond those who have returned from traveling abroad or those who have come in contact with those who have traveled abroad and may be showing symptoms. But is this enough? Several experts have been warning that India could be sitting at the precipice of an implosion or an explosion of coronavirus cases. Joining us now is one of the preeminent experts on this issue, Dr. Ramanan Laxminarayan. Pleasure talking to you. You've been warning literally from the beginning that we are under-testing, that there could be almost a kind of tsunami of cases, to borrow a phrase that you used. Do you think this change in protocol is enough?
So possibly the first Indian case, early in March, was not just limited to who was being tested. There were probably secondary infections starting right there in the community. Since then, we've only been testing people who either came off a plane from a COVID-affected country or someone who had a known confirmed contact with a confirmed case. Now, that meant we were missing all the other people who probably were transmitting freely in the community, and surely that was happening. And we can't assume there is none of that happening because we never tested any of those people. And ICMR sample of 1,000 in, where they say in flu-like illnesses is just too small. You're looking for...
They did random samples on nearly 1,000 who already had respiratory illnesses.
And
they said all of the tests came back negative.
All the tests came back negative, but to give you an analogy, you have about 25 million people with flu-like illnesses. You're looking for 6,000 severe cases. You can do the math. In 25 million people, is it possible to take 1,000 samples and find all of them negative? Of course, because most of the time you're going to find a negative. But doesn't mean that there were not 6,000 or 10,000 severe cases, and probably about 50,000 cases in India. Now, at this point, we probably are already into the hundreds of thousands of cases at this point. Just because that's the nature of the virus. The virus basically infects 2 to 3 people for every person who's infected, which is why you get this exponential curve that you've seen in China, in Iran, in Italy, in France, now in the UK and the US. And we're not.
So you're saying the growth of the virus is exponential, and there is no way that these numbers that we know officially are accurate?
I don't think anyone believes they're accurate. I don't think the Prime Minister would believe that the country should be warned about something like a Second World War if he thought that there were only 200 cases and 3 deaths. So I don't think anyone believes this.
You have, in a way, extrapolated the math of US and UK and applied it to India. And so tell our viewers, if that same model was applied to India, you've been talking about what, 300 million cases?
So let me explain.
So explain why we are applying the same model.
Right. Okay. So actually, we're not applying the same model per se. We're applying the same parameters as what we see.
So the nature of the virus and
the nature of the virus.
Spread. Yeah.
The model itself, which we use, is something called India Sim. This is a simulation model of the Indian population that has been built over many years. We've built this over about 8 or 9 years, widely published from in the best medical journals for various other things. We've adapted this to coronavirus. So some people may have the question, well, how well does an American model apply here? This is not an American model. This is actually an Indian model built in India. It includes the age structure of India. It includes, the demography, where the healthcare facilities are, everything that's localized to India. In fact, pretty soon we will be producing state-specific estimates of what's going to happen, possibly in the next day or two, and also with what resources are needed in every one of these places. So please don't think that these are some model from somewhere else that we're trying to apply here. No, this is called India Sim.
So I want to understand that, because every country has a different demography. So for example, one of the reasons that they say that the mortality in Italy may be as high as it is because of how high the elderly segment of the population is, and that there is great social mingling, intergenerational mingling, which doesn't exist, for example, in American societies. So when you look at the numbers that you're looking at, you have tailored this to Indian realities.
100%.
What do the numbers tell you after doing that?
So the numbers tell us that we're probably expecting somewhere between 300 and 500 million cases before the end of July. Now, before...
I just want to let that sink in. 300 to 500 million COVID-19 positive cases in the next few months.
Right. And you think of it, I don't think people should panic, first of all.
Yeah, because that is making me panic sitting
No,
here.
don't. Because if you had COVID, you probably won't even notice it possibly because it just will be a mild infection and goes away. We are not concerned about 100. Eventually, everyone in India will get COVID, just like everyone in India has had the flu at some point. Please think of it like the flu, but think of it as a more dangerous form of the flu where there's more mortality in the elderly. What we are trying to prevent now is not that everyone will eventually get the infection. The question is, if we go on this current trajectory, because today it's almost like having a lot of dead wood and there's a fire starting. The fire is going to burn through the entire thing. But there's a point at which the fire becomes so large that you just can't manage it. That's what we're worrying about, which is having an additional 1 million or 2 million deaths in India spaced over a 2-year period or even a 1-year period is not such a big increase.
I mean, it would not be considered a health calamity because of the state of
public health people might be concerned about.
It's a horrible thing to say.
It's a horrible thing to say.
It's a horrible thing to say but then that is what we're struggling with in a country with abject poverty as well.
Exactly. So if you said 10% more deaths in India this year, people might say, okay, is it worth destroying the economy over this? That is not the problem. This is a problem of public perception because that 10% of increase is going to happen in a 2 or 3 week period. And when that happens, so today I'm out here telling your viewers we're about to expect something which looks like a big calamity. During that calamity, when it does happen, and I say when because I don't see any reason why it would not, I would be explaining to them at that point to say, don't panic now because this will come to an end. When you see thousands of people dying, for someone who's not a disease modeler, they think, oh my God, this is the end of the world. What we're trying to do is to prepare people to say, is that we're going to see that for a period of time. It'll come to an end. And at that point, a lot of people would have been infected and then we all have immunity to the disease.
So first, the number, 300 to 500 million is what your numbers tell you for India alone from now. We're at almost at the end of March to July. So we're talking about literally what's called a surge.
Barka, let me also explain. There are 3 different models by 3 different groups. And all 3 come at a similar conclusion. Okay.
Now, within these numbers, it's very important to break it down and say how many do you think will be mildly sort of affected, as we would be by any other flu, and how many would be fatally sort of impacted. And does the math actually show you that kind of specificity?
Yes, absolutely. So, in fact, what we care about most in some sense is the peak number. Because the peak number is when everyone is rushing to the healthcare system and the healthcare system can't deliver for them. The peak we would expect somewhere between 3 and 8 weeks from now would have about 100 million people affected, 10 million severe cases, and of whom maybe 3 to 4 million would actually require critical care, possibly even more than that. But that's the number that would require critical care, and roughly about a third to a half of that is our mortality rate. So you're talking about 10 million. 5 million requiring critical care, and anywhere between 1 and 3 million, depending on how well we respond, is the ones that we're going to lose because they will need, oxygen flow masks and ventilators and all of that stuff. But that is just the peak number. Remember, this is going to continue beyond that. And it continues back. We'll probably have a break when it gets really warm. We hope and guess, we don't know for sure, but we're really extrapolating from the flu virus to say we're hoping this is going to happen. And remember, in November, December, it will come back, and there will still have been 700 or 800 million people that were never exposed to it, right? They were never exposed to the virus. So they will then get the disease at that point in time.
So just explain this to me even in a simpler way. Of these 300 million people, how many do you think can make it through as they would with any other flu or influenza?
So if it were, so typically every year, just to give you a comparison, India probably has, about 100 million, 80 to 100 million flu cases every year. We lose about 0.1% at best, very small number. Here, the problem is that the number is more like 2% and possibly even 3% given the state of our health facility, which is 20 to 30 times higher than what we lose in the flu. That's why we're sounding the alarm here for people to really protect themselves.
So that was going to be my next question. Is there anything that can bring these numbers down? I was reading the Imperial College report. The professor who wrote it is corona positive himself now, Neil Ferguson. And it said that this report made Trump and Johnson finally act. But the scenarios he paints are so dire. I mean, he's basically saying that even if you do like this complete lockdown, right? If you do moderate lockdown, moderate restrictions, you still don't have enough ICU capacity. You're 8 times less than what you have in countries like the United Kingdom. And if you do a drastic lockdown, the question has to be asked, can the world afford it? And there's very, very divided opinion on this. There are doctors and public health experts who are saying India needs to move into a major lockdown. And there are those who are saying not yet. And there are those who are saying it's not affordable. Where do you come in on it?
So again, you have to understand the math of the disease, and I'll try to explain it as simply as possible. We are exposed to the virus. It incubates in us for about 5-6 days. And then we have a period of symptoms for another week or 10 days following that. So you're talking about a 2-week period, which is why the 2-week quarantines actually happen. So today, if you have a coronavirus infection, you might not know about it because you were exposed to it 4 or 5 days ago, right? So the disease is growing under our feet, so to speak, as we speak. The whole point of the lockdowns is to really slow it down so that it's like putting a brake on that virus. It doesn't help to do it for 1 day. It helps to do it for a 2-week period. We missed the boat on testing. We could have tested a lot more. We could have prepared the population. We didn't do that. I don't want to get into why, but we didn't. If we had to do a lockdown, it would be now. We should lock down now for a 2-week period.
And would you think we need it immediately?
I think we need it immediately. If we're going to follow that approach, see, some of these are also political decisions, but if we're going to follow what the disease epidemiology says, you do the lockdown today. That's what the US is doing. The reason why Maryland and California, all these states are shut down 100% is because they figure if we do the lockdown today, we've slowed it enough so that we can come back to life in 2 or 3 weeks from now. If we wait for another 3-week period, it is too late to do the lockdown at that point in time. Then it doesn't make a difference because
So would you advocate a lockdown?
I would advocate an immediate lockdown, in fact, and except for the fact that I'm also mindful of the fact that in our country, a lockdown is actually probably difficult because there are people who have to go to work and, put food on the table. So it's a tough call. I'm conflicted because I know what the pain is. And maybe India doesn't have the luxury of a lockdown.
But what's the other alternative?
So the other alternative is to prepare for the tsunami of cases or avalanche or whatever your preferred metaphor is. There's going to be a large number of cases that come upon us between 3 and 8 weeks from now. And at least if we can be better prepared of all the severe infections, we will end up losing fewer of them. And I'll tell you the good news and the bad news in a sense. The good news is that there seems to be more evidence that there's some temperature and humidity sensitivity, which means that maybe the south gets hit a little less. And in fact, we'll have these estimates in the next year or two that may work in our favor. Seasonality is always helpful. The second is that we have generally a young population. Although in China, we are now just getting the data. There was a paper published yesterday, which basically said that although kids as a whole were less affected, kids under the age of 1 were severely affected. Wow. Then less from 1 to 5, and then less from 5 to 10, and then 10 upwards was less. So let's not be complacent about the very small children. The very small children actually do need respiratory support. They will have severe infections. So as a whole, they're not bad, but the small ones are going to need help. Indian kids are not as well nourished as Chinese kids in general, so we have a problem there as well. The other part of it is also that, we did buy ourselves some time with our border shutdowns and so forth. Today, I don't think the border shutdown really makes much of a difference because although, regardless of what ICMR says, the number of secondary infections in India is vastly more than what an Italian or an Iranian is bringing into the country.
Do you believe that we are already in phase 3?
We're 100% in phase 3.
Because ICMR just doesn't accept that right now.
There's a public messaging that
maybe it's panic management. I don't know what it is, but on record, they continue to say that there is no evidence of community transmission yet. And I just want to pick up something that's been in the headlines to ask you whether you think a sort of contact tracing can even work anymore. So we have this singer, Kanika Kapoor, right? Now, there's one person with exposure to a member of parliament who then potentially exposes all of parliament, exposes the president, the Uttar Pradesh health minister, who's met the chief minister, who, has interacted with the central government and so on. So it's a mess. Does contact tracing even work anymore, or are we already well in the phase of community transmission, in which case, what does contact tracing do?
Contact tracing is probably, we've reached, maybe if the window exists, it's for another 3 days. But that would only work if you also did the testing, because how else can you contact trace without the testing? But I think that window is already closing. So containment is not an option for India anymore. We're just going to have to ride out the storm.
So how do you calm people down on this number, 300 million from now to July, or maybe even more? How do we look at that number and make ourselves feel that we can get through this?
Let's not focus on the 300 million or 500 million, because most people will not experience that number. Because unless we even test, we're not going to find.
That was going to be my next question. Your estimate or your maths or your research tells you this. But if there isn't aggressive, widespread testing, and we're right now testing below our capacity, how will we even know the numbers?
Okay. So first of all, we do have to expand testing massively. I think everyone in the public health community has been saying this, and I think this is essential. I think the private sector needs to be brought into testing right away.
Do you think private sector should test for free? There's also a debate over that.
I hope they will test for free, or I hope they will test it at a reasonable cost. Not for me to say, but I certainly hope they'll make testing available widely, and I think they'll behave responsibly. I would hope. Testing should be widely available, should be available to anyone with flu-like illness, whether, and that's the change in ICMR guidelines as of this morning.
And the simpler tests, it is emerging now globally. I was reading that, Oxford University has some quicker tests. You don't have to wait as long for results.
So Barca, everyone has had this quicker test for the entire time. So let me explain this.
Please,
so there are two kinds of tests. Yeah. One is a test which is called RT-PCR, which basically is a genetic test to see if the virus is inside us using the actual genetic material. The simpler test looks for whether our bodies are developing antibodies against the virus. The antibody test is a much cheaper test, and it's a faster test.
And what is it, a blood test?
It's a blood test or a throat swab test, but it's not as accurate as the RT-PCR, which is a much more accurate test, but takes much longer. We've been advocating that let's not try to scale up this PCR test, for everyone. Let's do the simpler test. Maybe there'll be a lot of false positives, people who don't have the disease that you're saying have the disease, but at least we do that. That's what Korea used. South Korea used a model.
What happens if there's a false positive though? And
then you do a secondary test and you basically say everyone is positive. Then that way I'm only testing. But
there are no false negatives in this.
There are fewer false negatives. Fewer false negatives.
And therefore there's no kits problem with this.
Yes.
Is that the main point?
That's the main point. So there's no kits problem because Chinese and Korean companies are making these at scale. India could make this tomorrow.
Wow.
And I think this is a mistake. We should be using that rapid test extensively and testing right now. Now, let me get to the second question, which is eventually, how would we know if 300 to 500 million people had been infected by July? Because we're not going to test 300 to 500 million people under any scenario. For that, again, what scientists use is something called a serological survey. So what they do is they'll take blood samples from, say, 10,000 people. India is very good at doing this kind of stuff, by the way. And we'll, again, look to see how many people have seroconverted. So in other words, they have the antibodies to the virus. So that means that we've been exposed and our bodies managed to fight it off. So that we will be able to verify by June or July. And we will continue doing that. In fact, that's part of our recommendations to government that we should do it because we need this into the rest of the year as well. But the main reason we do testing at this stage is, as you correctly said, you test to find out if you're coronavirus positive so we can stay away from you and put you in quarantine. And that was what we should have done for the last 3 weeks, and we just did not do that. And we're reaching the end of that window where that becomes feasible because at this point, if 100,000 people, 500,000 people already infected, who do you quarantine and who do you not?
So at this point, you're saying, let's pick up the simple antibodies test.
Yes.
We're in the last kind of window where you still can. Yeah. And at least, even if it's a false, send the positives into a secondary test. Yeah. But you have some way of isolating populations.
Correct.
Right?
I'll add to that also. There is a room for testing for the elderly population. Since we know that everyone above the age of 65 is at higher risk, what we should do is proactively test anyone above the age of 65 that starts showing any symptoms at all, so that we can rush those people into care and don't wait for them to be a critical case before they show up. We need to deal with all of them proactively.
Okay, now let me make a contrarian argument to you. So not exactly contrarian, but to ask what lockdown is affordable to the world and to a country like like India. And let me just elaborate that a bit. I was interviewing Adar Poonawalla, who heads the Serum Institute. They're trying to work on building a vaccine. Like everywhere else in the world, a vaccine is going to take at least 18 months. So we have nothing this year. His question was that if you keep treading on livelihoods, there is a chance that bankruptcy, I'm just quoting him verbatim, that bankruptcy, crime, despair, suicide, riots is going to kill more people. That there is a real danger of that, especially in our kind of country where the inequities are so high. And there's so many people who simply cannot afford social distancing, right? So, and then I read another article today which basically said that we're taking draconian decisions on lockdowns in the absence of reliable data. So there is also this contrarian sort of question being raised.
So I would agree with Mr. Poonawalla that we've got to balance what works for our population. We can't do what the US did or what China certainly did. First of all, this is not an authoritarian country. You can ask for a lockdown, but you might not get a lockdown at all. And what are you going to do? Shoot people on streets? That's not going to happen. So I fully agree with that. I think that's why I think our best strategy now is to protect the elderly and the very young. We are passing the phase where this lockdown could have really happened.
But yet you did in this conversation say, let's do it immediately.
I said, if we are going to do it, let's do it.
Would you define a lockdown?
I mean, like similar to what happens in Italy. Everyone stays home. Everyone stays home. That's what many states in the US are doing. California is closed. Maryland is closed. New York is closed. I'm not advocating the lockdown in a political social context. I'm just saying, from the perspective of the disease, we need a lockdown.
To give the health system breathing space. It's
no. It's also
to isolate.
To isolate, and of course to give the health system breathing space so that we don't hit that peak. If that peak is only 30% as small, see, hypothetically, Barka, if we do that full lockdown in India, we would knock down the peak by about 70%.
70?
These
An immediate lockdown could...
Immediate lockdown over a 2-week period could achieve that. But again, as others have said, it's not possible in India because livelihoods are at stake and you won't get compliance. So let's look at what is feasible in India. It's not just India. It's India, Pakistan, Bangladesh, Nepal. We're all in the same boat here. What is feasible here is simply that let us now carry out the testing. Let us identify the elderly and proactively go after the elderly and test them, and also the very young. The main thing is we should start setting up massive temporary hospitals and facilities right away. I said this 3 weeks ago and people thought I was scaremongering, and maybe they still think I do. But I think we should have entire stadia with, maybe 50,000 beds in each of the major cities, maybe 100,000 beds with, oxygen equipment, which, doesn't exist to that quantity, and also with respect to ventilators. Let us then prepare. Let us say we're going to face this big epidemic. A lot of people are going to be very sick, but let's at least make sure that they don't die of it. That's what our option is.
But India has it has a low rate of ICU beds per population.
We have about 70 to 100,000.
Yeah, so I'm saying compared to America, which has let's say 34 beds, we have 2.3 is what I read.
Yep.
Somewhere, please correct me if I'm wrong.
You're right.
What happens then? How does the ICU system cope? When you say let's prepare for it.
First of all,
where are the respirators? Where are the oxygen? We don't have enough.
So I'll tell you what the other countries are doing, just so you know. Even the UK doesn't have enough ventilators. The UK doesn't make ventilators at scale. They have requested Airbus and Rolls-Royce, which are companies that don't make ventilators, to immediately start ventilators. If I were in the government's place, I would have someone, maybe the finance minister, call up Mr. Tata and Mr. Birla and tell them the country needs this. Please make 1 million ventilators over the next 3-week period.
Yeah.
I am confident that they can do it.
Yeah.
These ventilators are not hard to make, by the way. They're totally possible to make. So I think that's this war footing at which we need to prepare. And as Dr. Tony Fauci said in the US, it is better to be criticized for being overreactive and overprepared than to find ourselves, because if we do that, we will avert these riots and all of that stuff. When does that happen? When you have a situation like happened in Italy, where you have 1 ventilator and 4 patients, and you don't know which one to give it to. Then you're literally deciding who lives and who dies.
So the United Kingdom initially tried what they called herd immunity, and then they sort of retracted from that very hastily. But there is one argument, and I don't know anything about medicine. I'm asking this as a layperson. I've heard this said again and again, the virus is here to stay. And the virus, even if there's a vaccine, the vaccine would have probably 60 to 70% efficacy. The vaccine is a year away. Is there an argument to be made, without sounding insensitive, that there is no option for some of us but to get infected and develop immunity?
That will happen as a matter of course anyway. But the way to do that is not to unleash the virus on everyone right now, because two things. One is that the virus will naturally mutate over time to be killing us less. You have to remember, the virus has no interest in killing us. It doesn't do better by killing us. In fact, it does worse. Let's say the virus, just for argument's sake, killed 100% of people that it infected. The virus will never transmit because it comes into me, it kills me, everyone's going to stay away from me, then it's gone. Viruses that are successful are like the common cold viruses that don't really kill us, and they transmit, and they're happy and we're happy. So that's the happy state.
Why is this virus different from other influenza viruses where, as you said earlier in this conversation, we don't even notice or talk about the data of how many people may die from complications related to influenza in our country. We should be having that conversation, but we don't. We need to understand why this is different. Is it the galloping pace of spread? Or is it that it's more lethal? Because people need to understand this. Because if you look at the mortality rate, it is actually, its volume seems bigger. Forgive me if I'm using non-technical words, but its scale or its spread seems bigger, but its mortality rate seems lower than what, SARS?
It's lower than SARS.
So explain then why we need to be more afraid of this virus than we have been of other viruses.
Okay, I would not use the fear metaphor. I don't think we should be afraid. I think we need to understand this with science. And I think you just have to understand this. There's no other way to do it. This virus came from animals. And just so your viewers know, this happens every day of the year. There are viruses jumping from animals into humans every day of the year. Maybe not every day, but happening very often.
Animals as in eating meat?
Anything. It could be living in proximity to animals. It could be...
our dogs?
No, dogs actually also transfer some bugs to us. So drug-resistant bacteria can come to us. So you have to remember, you think you're sitting here and I'm sitting here. We're actually like fish living in an ocean of bacteria and viruses. They were here before us. They'll be here after we're gone. And they make life possible for us. But there are trillions of them around the place. To say I don't want to touch a virus is pretty stupid because they're everywhere. It's not possible. So what happens? The virus moves from an animal to a human being. It usually doesn't transmit. At worst, it might kill that person, but that's a dead end for that virus. And generally, all infectious diseases are, as epidemiologists say, it's a case of misunderstanding between the virus and us. It really doesn't really want to kill us.
I mean, how benign and sweet you make this virus sound. Yeah.
That's what it infects us, and then the human body has never seen this before, and the human body goes berserk. It engages in what is called a cytokine response, and it's actually our significant immune response to this invader that ends up killing us, because we've never seen anything like this before. That's what happens. This particular virus happens to be, so it jumped from somewhere in China from an animal to a human. It then was able to do something that very, very few viruses are capable of doing, but happens once in a while, like with SARS, like with MERS, like with Nipah, which is it was also able to be transmitted from one human being to the other. Not only did it do that, it started doing it pretty well. It started doing it extremely efficiently, because this virus is both in our lungs and our upper respiratory passage. So when we cough, it's out in droplets. So it learned how to do that really well. The mortality was just a function of, it doesn't intend to kill, but it kills 2% of people who have, heart disease or diabetes or whatever else it is. Over time, this virus will almost certainly, and I say only almost because there are instances where the opposite has happened, almost certainly evolve to be more benign, and the mortality rate will come down. So in response to your question, yes, we are going to live with this virus forever now. But it's not going to be an issue for us 2 or 3 years from now, or maybe in a year from now even. It will just be one of the multiple viruses that infect us. So I don't think this is like it's changed our life forever. Literally, we need to be worried about this next 10-week period and get through this 10-week period and just somehow get through it. After that, we're fine.
Can you speak to the economics of it? Because it matters, right? In the US, they're talking about $1,000 checks. Some want it to be $2,000 checks.
Yeah.
We're not even having that conversation yet, but we're going to have it very soon. We're going to have it very soon. Already you have people who, daily wage laborers, Uber drivers. You have household help. You have people who are being forced to work from work because their companies won't let them. You have layoffs. What about the economics of it? And that is why some people are so worried that we should be locking down only if we absolutely have to.
So there are two scenarios. You do the lockdown, you inconvenience a lot of people, and then you've got, I'm not suggesting we do the lockdown necessarily. That's a political decision. I'm saying if we do, we inconvenience a lot of people, but we have taken off that peak, which means when the time comes, we're not going to have the severe infection that Italy is coping with. So that's the benefit of doing this extreme social distancing, which is what the Prime Minister wanted to say. If we don't do it and we say we go out to parties, we do all of this stuff, we're going to hit that peak.
No, so obviously no parties, but if you shut down the country.
But let's just say the alternate, which is we're not shutting down the country. We're doing some amount of social distancing, but overall we're not putting any draconian measures. What happens in that situation? The public is going to see a rise in deaths happening very suddenly. All the elderly start, going. Then you're going to have people not willing to touch the bodies. I'm not painting hypothetical situations. This happened in Iran. They had to do mass burials because nobody would touch a body. Because then fear and panic sets in. And that's why we're trying to explain as much of the science in advance right now to prepare people for what is coming up. But people should also know that that peak will happen, but that peak will also come down.
So that's what I want to ask you in the end. Like, give us something concrete that should help us feel better. No, really. What should we be doing? Like, see, people don't know.
Yeah.
My crew is wearing masks.
Yeah.
I'm not wearing a mask because the science, as I've understood it, is that only if you feel you have the symptoms should you wear a mask, and you should leave the masks for health workers.
Yes.
So I don't know, but most people don't know. People don't know, is it okay for me to step out and take a walk in my neighborhood park, right?
Yes.
People don't know, is it okay for me to meet at least my best friend for dinner? Nobody knows what to do. So one, I want to ask you, what are the absolute don'ts? And what is it okay to do? First that.
Okay, so the absolute don'ts are, and I see this all too often, don't cough into the air. Cover your cough, do the vampire cough. It's something we need to all learn as a society generally. We need to teach it in our elementary schools. We need to do this. So don't cough into the open. Certainly wash your hands. Wash your hands for 20 seconds, 5-6 times a day. Take a shower if you've come from the outside. That would really help a lot so you're not bringing bugs into the house. I think if we did just these 3 things, we're already quite far along. Don't panic about unnecessary stuff. Turn off WhatsApp if you can. Literally turn off WhatsApp if you can. I don't get this, but I've been told that people are promising cures for coronavirus. It doesn't exist. Don't bet on a vaccine. Don't bet on, we have no evidence that homeopathy works. None of this stuff. It's really simple. Wash your hands, cover your mouth, and, if you can, take a shower after you come.
Should you be meeting people?
So if you're meeting people, see, again, think of how the common sense of how this works. If you have a cough or a cold, stay home and don't meet anybody at all. If you don't have a cough or a cold, it's fine to have your neighbor or a good friend over for dinner, and because you need to keep your mental peace as well and be able to talk to someone about it. The idea is not to do stupid things here. It's actually to be doing very sensible things. If you're an 85-year-old, and my mother is on lockdown, has been for the last 4 weeks, by the way.
You've had better luck with your mother than I've had with my father, is all I can say to you.
Well, I told my mother 4 weeks ago, in fact.
She listened to you?
Well, I said, you're just not going out. That's it. And she would go to the temple. Unfortunately, the temple has been locked down. So that's her only avenue, and that's out. But if you're the elderly, for God's sake, stay home. That is the bunch that should just not be getting exposed to anything at all. I would again urge, don't panic. We can get through this. If we do all of these things, you don't need to wear masks. You just do not need to wear masks at all. In fact, keep the masks for healthcare workers. And again, the 3 at-risk populations. Yesterday, I would have said 2, but today, looking at the new paper that come out, it's 3. Above 65. Second is healthcare workers. Please, be mindful of the fact that your doctor or your nurse is putting their life on the line for you. They literally are putting their life on the line for you. In Wuhan, 2% of the deaths in Wuhan were in healthcare providers. Okay, and then the third thing is, of course, now we're seeing emerging evidence for small children. So keep small children, well protected, and especially under the age of 5 and perhaps even under the age of 10. Because we're seeing, this is just very, very new evidence that was just published last night. But if we do this, we will get through this. And I don't think we should then have to panic after June or July, because at that point, we've all been exposed to the virus, and the virus will find it more difficult to transmit because most of us are already, immune to it. And then we're home safe. So let's just keep each other close and take care of each other.
I mean, talking to you, I feel like that, when we were children, we would go to our pediatricians and they would give us injections and then they'd give us a toffee at the end of it. This is sort of like that. You're trying to tell us that we can get through this, but it's important to not panic. It's important to science only, facts first. Thank you, Ramanan. Thank you. It's been a pleasure talking to you.
Likewise.
Thank you.